It is Thursday. That means we're talking Mind Matters. Last week, psychotherapist Folkerts joined me to talk about anxiety, and he shared a topic with me, something I hadn't heard before. It was called compassion fatigue. Well, not long after our interview, the Ohio Department of Mental Health and Addiction Services sent out this press release sharing an awareness campaign to try and recruit and retain more professionals for Ohio's wellness workforce. They saw the need for behavioral health services outpaces the professionals. That's leaving 2.4 million Ohioans without access to care. It's an issue. So we brought Folkerts back and his colleague from Cornerstone Behavioral Health, Shannon Gallagher, to talk about all of this. And let's just hit it. First of all, you shared something with me that I never heard before, compassion fatigue. What is it?
So compassion fatigue is a combination of two different things. So we have burnout, which any of us in any industry can experience, right? So it's essentially the strain and stress reaching a tipping point related to what we do for work. So there's burnout, but you have an additional piece with compassion fatigue, and that's secondary trauma, right? So secondary trauma is when you're experiencing vicariously trauma symptoms in relation to someone else who's directly experienced something traumatic, right? So it might not be that I was mugged, right? But I might hear through talking with a client about someone's experience being mugged. And so there's that secondary trauma response.
Wow, and that is a lot. And Shannon, this is the field that you are in. You chose to go in it. Tell me why you believe people are leaving.
Yeah, so there are a lot of people in the field experiencing burnout relating to the secondary trauma, but I also think it has a lot to do with high workloads, stressful work environments, and even our own personal, life situations. Those things all come into play when when people are burning out, if they don't have a strong support system, if they don't have a strong team at their office, if they don't feel supported by their employers, those things are all driving people out of the field.
So is this a call also to the employers, let's say you're where you are, to be in tune to the people who are working for you? Is there something in place?
1,000%. That's the call. Not every place is necessarily meeting that call, but hopefully over time that builds momentum, right? So we need to be mindful as administration, right? We need to be supportive of that front line. That front line is providing the true value to clients. And so if we're not supporting that, that's deteriorating, that's affecting the service that we're aiming to provide.
Yeah, we're talking millions of Ohioans not being able to get the mental health care that they need. Is this campaign that the state is about to launch, how do you think the response will be to all of that?
Yeah, so I think it has a really, strong push for people to call to the field, but I think there's a lot of things that need to happen in order to back it, and Caleb can speak a little bit more to that.
Yeah, I agree with Shannon. I would add that, attrition competes with trying to recruit, right? So we certainly want to recruit. That's a good sort of one leg in this race. But if we want to really win the race, it's decreasing that attrition piece. So, I mean, you're looking at 70% of nurse practitioners, 70% of social workers, 54% of counselors. You're thinking about that in a graduation class, right? Any graduating class, any behavioral health professional, that's a very sad statistic. And it's something that we can affect. We have science, we have evidence-based ways of approaching that and supporting our staff.
Yeah, and with this big story we're following today, the people out in Lorraine, with the 3 officers shot, mental health professionals will be needed.
Absolutely. Yes.
And this is what we're talking about today. Hopefully people will listen to this. Compassion fatigue, it is real. What you guys do is difficult. It is not easy, but hopefully people in your field will speak up and say, I'm having a problem, and get the help they need.
Absolutely.
So they can continue to help others.
100%.
Thank you for enlightening me on this term. I never heard of it, and it was just so that right after you said it, that the state releases this information that Ohioans, we don't have enough mental health care professionals to help them. So hopefully that'll turn it around. Shannon, Caleb, thank you so much for being here today. Yeah. And we'll have you back again.
Thank
Mind
you.
Matters, Mind Matters. All right, let's get a check on our weather right now. Matt, what's happening?